Delegate Byron.
Thank you, Mr. Chairman. I realized we were pressed for time. I started to get concerned and then got more concerned when I was following Delegate Marshall.
Not without good reason.
That's not a good sign in the beginning. House Bill 1419 would end Virginia's status as the only state in the nation to mandate a vaccine intended to prevent a disease that is not transmitted through casual contact. Because I'm not a physician, I have a lot of data sources. We probably have a physician or two that arrive that's going to come in and give their passion on the other side of this, and that is the issue. Doctors are on both sides of the vaccine and its use and its efficacy. And just to give you a little background, and I'll be quick, in June 2006, the Food and Drug Administration approved the first vaccine for the prevention of HPV. Sold as Gardasil, the vaccines intended to prevent HPV strains 6, 11, 16, and 18. Following the approval, the National Advisory Committee on Immunization Practices recommended routine vaccine requiring 3 doses of the vaccine for girls ages 11 to 12. Washington Times reported that then Chairman of the Center for Disease Control Advisory Committee on Immunization Practices, Dr. Abramson, advised lawmakers against making the inoculation mandatory. Further, he told the Times that he and the ACIP panel members cautioned Merck against lobbying state lawmakers to require the vaccine for school attendance. Despite these admonitions, state legislatures around the country were subjected to an intense effort to pass laws mandating the vaccine, and this was an effort spurred by Gardasil's manufacturer. The Michigan Senate was the first to introduce legislation in 2006 to require girls entering 6th grade, but the bill was not enacted. Ohio also considered legislation in late 2006, which also failed. The governor of Texas used executive orders to mandate the vaccine, a decision that was overturned by the legislature. In all states, in all 40 other states in the District of Columbia, there was introduced language to require, fund, or educate the public about the HPV vaccine. Despite the intense lobbying, 18 states approved educating and funding, but Virginia remains the only state in the nation that puts its stamp of approval on this medical decision by mandating this vaccine with an opt-out provision. 4 years have passed since we enacted this mandate, and Virginia remains the only state to have one. All 50 states require vaccine for several childhood infectious diseases as a condition for school entry. State efforts to mandate the HPV vaccine in minors have raised a variety of concerns on legal, ethical, and social grounds. Unlike other diseases which state legislatures have mandated vaccine for children, HPV is neither transmissible through casual contact nor potentially fatal during childhood. It is also the first vaccine to be mandated for use exclusively in one gender. While the emergence of an HPV vaccine reflects a great potential significant public health advance, the vaccine raises several concerns. The long-term safety and effectiveness of the vaccine is still unknown. Middle school girls will be no older than 18 when they pass the vaccine's 5-year proven effectiveness, more than a decade before the typical cancer patient contracts HPV, and they will require an unknown amount of booster shots. The vaccine was also not tested in girls under 15 years of age, and serious adverse events reported shortly after the approval raised questions about its short-term safety as well. Although I opposed this from the beginning, it was information recently uncovered by Judicial Watch, reports taken directly from the Vaccine Adverse Event Reporting System, that caught my attention. Those reports through the Freedom of Information Act showed 3,589 adverse reactions between May 2009 and September 2010, including 213 cases resulting in permanent disability and 16 new deaths, bringing the total reactions to over 17,000. Now, you may hear from others later that some of these are not serious, but if you look at them, and I have looked at the individual records that are available on the web, if you look at them, serious definition is loss of consciousness, paralysis, things that I know that my definition is not the same as what the government used as not serious. While some say the risks outweigh the benefits, are each of us prepared to take those risks for young girls, prepared to tell a mother who didn't know all the risks that you thought it would be okay for their child? I've heard from families all over the country since I put this legislation in October. A school teacher just called me the other day from North Carolina during recess to tell me about her daughter, who she and her doctor are convinced almost died from the vaccine, to ask how she could help. Amid questions about the safety of the HPV vaccine, CBS News reported on one of the lead researchers who is speaking out against Gardasil risks and benefits and the aggressive marketing of the vaccine. Dr. Harper says young girls and their parents should receive more complete warnings before receiving it. Dr. Harper helped design and carry out phase 2 and phase 3 safety and effectiveness studies to get Gardasil approved and authored many of the published scholarly papers about it. She has been a paid speaker and consultant to Merck, so it's highly unusual for a researcher to publicly criticize a medicine or vaccine for which she helped to win approval. In light of these unanswered safety questions, the vaccine should be rolled out slowly, with risk balanced carefully against the benefits. This bill would return the decision on whether or not this vaccine should be administered to parents and their doctors. By removing state government from the position of requiring and effectively endorsing it, a vaccine that has had its safety called into question, we would be ending the intrusion of the state into a decision that should be left entirely to parents and their physicians. I don't think there's anyone in this room that probably hasn't been affected by someone who has cancer. My mother died 2 years ago from it. We want cures today, but we need to let the drug companies market their own products and let the doctors take the risks and keep up with the ongoing medical information that comes out and advise their patients. There's not consensus among the doctors. The doctors on the House don't all agree on it. How can lawmakers continue to intrude on these decisions that should be left to families when we don't even have consensus? Although we may have been, and I'm sure we were very well intended when we approved this mandate in 2007, it is still telling that no other state has followed our example. But regardless of the reason, Virginia remains alone in mandating this, and for that matter, requiring any vaccine intended to prevent a disease that's not transmitted through casual contact. This substitution of our judgment for the judgment of parents is exactly the kind of government intrusion that America is rejecting today in Washington. And Mr. Chairman, our time is short, so that basically summarizes my request for this bill.
Thank you. Questions to the patron on the bill? Hearing none, we'll hear from witnesses. Those who are here in support of the bill, if you come forward, give us your testimony, and again, we will ask you to be concise.
Mr. Chairman, members of the committee, Chris Friend of the Family Foundation, I will be very brief. Delegate Byron mentioned Dr. Diane Harper of Dartmouth Medical School has serious concerns over this. Dr. Charlotte Howe, another HPV researcher, asked in a New England Journal of Medicine editorial regarding the Merck drug, how can policymakers make rational choices about the introduction of medical interventions that might do good in the future, but for which evidence is insufficient, especially when we will not know for many years whether the intervention will work. She concluded, with so many questions still unanswered, there's good reason to be cautious about introducing large-scale vaccination programs. Members of the committee, regardless of Merck's defenders, according to published reports, doctors are paid $4,500 a piece to promote the drug. There is division in the medical community over this, and because of that, there's confusion among parents, and we would ask you to support this legislation. And with the chairman's permission, I do have a letter from a mother whose daughter was adversely affected by the vaccine, and she could not be here. She asked if we could distribute her letter to members of the committee.
The committee will be pleased to receive the letter. Next witness.
Ed&Health Executive Director, Virginia Assembly of Independent Baptists. Our parents appreciate the freedom to make decisions for their children like this.
Others here who would like to speak in support of the bill, please come forward. Seeing none, those who are here in opposition, please come forward, state your name, who you represent, and try to be concise in your testimony.
I am Dr. Wendy Klein. I'm here on my own behalf as a physician who has spent the last 26 years trying to advance the health of the women of the Commonwealth. A couple of things, with all due respect to Delegate Byron. The safety data, the concern about safety is really bogus. I am simply here to tell you, I'm going to try to be brief. We have dispensed 52 million doses in this country, and this vaccine has been given in Europe for many more years than it's been given here. It has been under scrutiny. The CDC, the FDA, the American Academy of Pediatrics, the American Academy of Family Physicians all endorse this vaccine, have found in looking at safety data that there is no pattern of causality. The kinds of cases that the delegate mentioned that are put up by Judicial Watch, if as a physician and scientist, you look at these cases, what you see is a host of confounding illnesses. The children who have had adverse effects have chronic illnesses, are on other medications. I was looking at one report on their site. The child was reported to have died, but it was difficult for a layperson to determine that this was a child who was on drugs for malaria. So you have to be able to sort this out, and it can be very confusing. There is, in my mind, not only not a safety issue, but I couldn't get this, I could not give this vaccine to the children of the Commonwealth quickly enough. It is the first vaccine against cancer. My kids tell me this is a duh. It in fact does help to protect against this oncogenic cancer-causing virus that we now know is transmitted casually. It does not require sexual intercourse. It can be transmitted by simple contact of oral mucosa. So, and by the way, speaking of oral mucosa, this is a vaccine that prevents cancer of mucosal tissues. That is the cervix. That is also the throat, the tonsils, the rectum. We are now accumulating a vast wealth of evidence showing that this is protected against all of these. And the more children who get this vaccine, the better the outcome. The other issue that I keep thinking about is when I hear that Virginia is the only state that mandates this, I am so proud of Virginia. I invoke the wisdom of my mother, who used to say, I don't care what your friends do. If your friends jump off a cliff, will you jump off a cliff too? Virginia is a shining role model in the realm of public health because it is trying to protect our kids and in the years to come, women and men from these cancers. The other thing is that cost. The governor's task force on cervical cancer in 2005 embarked on studies, and I was part of this task force in 2008. We found that the greatest barrier to people getting this vaccine is cost and access. The greatest incidence of cervical cancer is in the women who are poorest. If you remove this mandate, those are the women who will suffer the most. So if you really care about addressing health disparities, why fix what's not broken? And again, there is an opt-out. Anybody who doesn't want their child to have this can opt out. So I certainly hope you will oppose this bill.
Thank you for your testimony. Others here in opposition to the bill, please come forward and try to be concise with your testimony.
My name is Sam Laurel. I'm here representing the American Academy of Pediatrics. We support the current mandate and respectfully ask that the HB1419 be defeated. It provides it's a matter of access and equality, like was mentioned with the previous speaker. Approximately 11,000 women each year die of cervical cancer. Approximately 330,000 women have to go undergo some procedure, surgery, chemotherapy, radiation for cancer solutions. And about 1.4 million women have some form of abnormal pap smear. And it's found that the HPV vaccine can prevent up to 70% of these cancers. The cost that it takes to treat someone with HPV now is equal to about the same that it does HIV on a national level. And they found that treating and vaccinating the young before they're sexually active cuts down the risk of transmitting the virus that causes cancer, and in turn also saves in the long run. The American Academy of Pediatrics, American Academy of Family Practitioners, Society of Adolescent Medicine, American Colleges of OB/GYN, all support, come out saying they support the vaccine.
Thank you, sir. Others here who are in support or in opposition to the bill, you'd like to come forward. Delegate Byron, let you give us a brief wrap-up. If you
Brief wrap-up. Two quick things. One, I checked multiple times. The cost for this vaccine comes under the children's for immunizations. The budget also has money in it, whether it's mandated or not. I was told that doesn't prevent us from putting a budget amendment in to remove the funding. But there is funding in there. Even without the mandate, they fund vaccines. Two, as far as the doctors, I have the greatest respect for our medical community, and that is what I advocate for, is people being with their doctors and getting the advice that they're offering here. What I don't advocate for is taking this away from the parents and saying to them that whenever there is a wonderful, and believe me, I hope there is a cure for cancer and preventative of all these different diseases, childhood obesity, so many things that we're going to look at every year. But are we going to come down and mandate every time there's a good medical prevention that we require our young children or people to have it? Thank you, Mr. Chairman.
Thank you, Delegate. The bill is before the committee for proper consideration. What's your pleasure?
Mr. Chairman. Mr. Chairman.
Senator Blevins?
You acknowledge me?
Senator Blevins.
All right, thank you, Mr. Chairman. Senator Delegate Byron, it was mentioned earlier that the requirement of being able to opt out. Would you address that? Can a parent opt out? In other words, they don't have to do it? Is there an opt-out provision?
There is an opt-out provision, but I have heard from many people that that's very confusing, and we also, by having an opt-out and putting the requirement in there in the first place, we almost put our approval that we all agree that in all the safety and all the other things surrounding this, and we certainly want it to be that way, but an opt-out is not the same as an opt-in, where parents actually want and understand that they want to do this.
Senator Newman.
Mr. Chairman, Kathy has done an enormous amount of research on this, has educated me and so many others, and I know it may not work out in this committee, but I would move that we recommend that we report the bill.
Substitute motion, second, the bill be reported. Substitute motion, Senator Sasson.
Yes, I'm definitely.
Substitute motion that has been seconded is to pass the bill by indefinitely. Discussion on the motion.
Mr. Chairman, could I make a brief statement on that motion?
Senator Northern, discussion the motion to PBI.
Thank you, Mr. Chairman. Just as a pediatric neurologist, I have in my career been at the bedside when patients were being cared for and dying from, and just go through a few of them with you: polio, pertussis, which is whooping cough, measles, mumps, rubella, and finally cancer. And you know what I would say to this panel is that I don't see those anymore. And fortunately, the reason I don't see them is because we have immunizations now. All of those diseases that I just went through are preventable, and not to mention 3 types of meningitis that I also take care of. So I would say, Mr. Chairman, I think we're a bit spoiled when we say, well, this isn't necessary, but I think if you've been at the bedside and had the opportunity to talk to parents or loved ones of these patients and ask them if there was a shot or 3 shots that could have prevented this illness, would you have opted for that? I don't think there's anybody that would have said no. So, Mr. Chairman, members of the committee, I would hope that we agree to PBI this bill. Thank you.
Any further discussion on the motion to PBI? Hearing none, all those in favor of the motion to PBI signify by saying aye. Aye. All those opposed? No. Can you record your noes, please? Clerk will announce the vote. The motion to PBI is successful on a vote of 12 to 3.